Today for Coffee Talk, we're going to talk about barcode lines. These are the smokers' lines and barcode lines that women tend to get as we get older. Sometimes it's genetic, sometimes it's as a result of smoking, and more often than not, it's because you've just gone through the menopause. Let's talk about that today. And this is something that we see when clients come into our clinic here. They hate the edge lines that they have here on their upper lip. And they're often called smokers' lines, even though you don't have to be a smoker to have them. So to go through, if you want to make sure that you are using the right skincare and using your UV blocks every day, because that breaks down the elastin and collagen fibers around here, and then you need probably some retinol to try and build up as much collagen as you can, and that's in the nighttime. So there's lots of ways that we can help you in relation to minimizing these barcode lines on your upper lip. Anything from simple makeup tricks to injectables, all the way through to laser or secret RF treatment, which needs quite a bit of downtime. So there are some that I can help you with, and there are others that I can't help you with, but I can point you in the right direction. So there's lots of ways to be able to deal with this and to target this area, but there's no magic wand for all of it, and you have to do a couple of things together in a combination of things to be able to make it work. So we would refer some clients occasionally for Botox to this area here, done very subtly. It'll help to stop the dynamic lines. The downside of it is in the wrong hands, it can make you paralyzed here, that you won't be able to move your upper lip at all. So it needs to be the right person that you go to for Botox in that area. I don't do Botox, I'm not a prescribing nurse, but I can refer you to somebody really good. Sometimes we use a little bit of filler, so Bellatero Balance, or we might use Bellatero Lips just to reinflate the upper lip, and by doing that sometimes it actually minimizes the barcode lines. Or we'd use Restylane Kiss. It's very dependent on your areas of concern. If your barcode lines have occurred as a result of deflation of the upper lip, well then we would reinflate the upper lip. More often the vermilion border, which is the difference between the white and the pink line here, or the pink lip here. It's that line here, it's called the vermilion border. So we'd reinflate that, maybe put a small bit of hyaluronic acid into the upper lip as well, just to rehydrate it and give it a little bit more volume, and that then in turn minimizes these barcode lines. Each of these lines can be injected from the side 3 to 5 times to minimize and soften the look of these lines, and this is usually done with Bellatero Balance, and it needs to be attended to every 6 to 9 months, usually around the 6 month mark. So it's not treated in isolation. I know people come into me and they say to me, oh my God, the barcode lines are really annoying me. Can you just treat those? And invariably just treating them on their own is not enough, that we would have to reinflate the upper lip as well. And then finally, if they're not softening them for you, well then we would refer you on to somebody to do maybe laser treatment like the Secret RF or the Secret Pro, whereby you have laser on your upper lip. Now there is about a 10-day to 3-week downtime in that, and you need to plan in advance. But it resurfaces this area and it softens it. So you've got 3 options: makeup, injectables, or laser. So I tend to the injectables in relation to that. If it's skincare and skin advice you need, I would refer you to Shirley Malone, who's in the room next door to me. And if you're looking for a laser, I will refer you to somebody in Cork, or if you decide to go down a bit of subtle Botox route, well then I can refer you on to somebody in Cork as well. So I hope that helps. But barcode lines are something that men rarely get, women get a lot of as we get older, usually when we're past menopause. They're dynamic lines and the collagen has broken down, and yeah, we need to be able to sort of get that back in there. But they're rarely treated in isolation, because the last thing we want is for us to treat the barcode lines and for those to be minimized and softened, but that it distorts the rest of your face. So we take the whole mouth area into consideration when we're doing injectables for that area. So if you're wondering if it suits you, get in touch. We'll send you out the information pack. It's free, obviously, by email, or you can book in a consultation and we can have a conversation in relation to it. This is something that I have done myself, and I have it done every 6 months, and it has minimised the barcode lines that I have on my upper lip. Does it get rid of them? No, but it certainly has softened them hugely. I've also had my vermilion border re-inflated and my upper lip re-inflated as well. So it wasn't taken in isolation, and I'm very happy with the results to date. So hyaluronic acid is something that we inject into those areas depending on what your concerns are. All right, I hope that helps.